Here we go. Hi, I'm Dr. Behnam. Sorry about that. I really get a chance to talk. Here we go. I really get a chance to talk to everyone about their hair routine and about happy ed. So I'm truly very excited to be on these sessions. Today, our first slide is going to be. We're first going to talk about our introduction. So today is. So let me put up the screen. Here we go. So one of those Tuesdays, guys. Okay, perfect. So first of all, how does the ordering process work at Happy Head? So the way it works is that you could literally order Happy Head, which is a prescription compounded product, without actually going and seeing a doctor in the office. So first of all, according to clinical studies, the topical minoxidil finasteride shows about an 83% improvement in patients' hair, which is great. This is a subscription service, which means that on a monthly basis, it's going to be shipped out to you, and all of the care is provided exclusively by board certified dermatologists. So the way it works is that you're just going to get on their website and fill out just a very simple health questionnaire. And then legally, since this is kind of still considered a medical office, we still have to see you, see your photos, and also we have to verify that it's you. So legally, we do ask for your ID. That's just a legal requirement. And also, you do have to send your photos so we could take a look at you to see how your hairline looks like, whether if you really need Happy Ed, do you really qualify for Happy Ed. And then once you submit your questionnaire and the photos, which literally only takes about 4 to 5 minutes, it's going to be submitted to a board certified dermatologist who reviews your medical history, allergies, past medical histories, and your photos, and sees if you are a good candidate for Happy or not. And if you're a good candidate, then he's going to prescribe the medication for you and send the prescription to our pharmacy, who will then customize the product just for you, and then it's going to ship it out to you. So we're actually the pharmacy literally makes the product fresh just for you, and is shipped out on a monthly basis, basically moving forward. So that's how the entire ordering process works. Again, if you guys have any questions, please let us know. So here we go. We're going to start with the questions this morning. And again, if you have not tried Happy Head before, please you could start by putting in my name, Dr. Ben AMA 50 for 50% off your first order. Okay, now this morning I was already talking to a patient of mine who had called in, and he basically did not wanted to didn't want to have the minoxidil in the product. So I told him, look, it's very easy. Happy Ed is customized just for you, so we could easily take out the minoxidil concentration, the minoxidil ingredient, and we'll just ship you the finasteride along with the retinoic acid and aloe. And he was very, very happy because apparently he was using another product and you couldn't customize it. Again, guys, at Happy Ed, this is a customizable solution just for your hair loss. This is not one product fit all strategy. We really care for every individual patient out there. And we're willing to make it fresh for you every month. What's gonna fit for you? So, if the formula is customized, why can't the aloe be omitted to avoid the hair tackiness? That's a great question. The reason is because the aloe is part of the vehicle, um, and typically we don't remove that. However, I will go back and talk with my pharmacist today and see what we can do for you. If you don't mind, please send us an email. So I just have your contact information, and I will definitely get back to you. That's a great question. we'll try to see what we could do about it. Again, the only reason why we had the aloe initially was because a lot of, some people were using it and the minoxidil was a little irritating. That's what the aloe is in there. But let me see if we could take it out. Thank you for that question. And one of our patients from Instagram says, "Is this a topical finasteride?" Yes. This is a topical finasteride formula. So I know traditionally the finasteride has been an oral medication, but this is topical. Most patients do not know that finasteride comes in topical, but we make it. We're one of the first ones in the market to start doing this about 2 years ago. And remember, it's also customizable, which means we make it just for you. So if there are other ingredients that you don't like in it, we'll be more than happy to take it out. But we are proud that actually our product has 3 powerful ingredients in it. It's topical finasteride, minoxidil, and retinoic acid, and it's a synergistic effect of those 3 ingredients that typically give patients really good results. One of it, another patient on Instagram asked, do we need blood work? No, we do not need blood work basically for this product. It's just a matter of filling out the questionnaire, and also sending some of your photos and ID, and the doctor will evaluate you and then send out the formula for you. The active ingredients in Happy are about 10% or less of the formulation. What are other 90% in ingredients, and what's the percentage of alcohol and other stuff? So first of all, you have to realize that in order for the minoxidil to penetrate the formula, you have to actually mix it with some alcohol. Otherwise, the minoxidil will precipitate out of the formula. And that's not true just with our formula. That's true with even the minoxidil over the counter and the Rogaine over the counter. We do need some alcohol in the product. So a lot of it, basically, the way the vehicle works is that we have aloe along with some basically. Sometimes there's water and basically some ethanol and propylene alcohol. Those are the ingredients basically of what we call the vehicle. And then once we have the vehicle, basically we add other stuff to it. So for example, finasteride, minoxidil, as well as retinoic acid. Thank you so much for asking that question. So another patient asked, all ingredients that are custom compound in your specific formula are FDA-approved ingredients. Oh, I already know this one. This one of my assistant writing that. So I use minoxidil and laser cap. Can I use your topical products along with the minoxidil and the laser cap? Can I ever stop using minoxidil? I tried and hair started to fall out. So yes, you could use our product in conjunction with basically other other modalities. For example, you could use a laser cap, and you could also use our Happy product with the over-the-counter minoxidil as well. Happy already has minoxidil, so you don't necessarily have to use a separate minoxidil. And the question is, can I ever stop using the minoxidil? Well, with every hair product, once you start, you pretty much have to use it forever. Otherwise, the hair is going to fall out. Now, some patients, in some cases, the minoxidil could cause some initial hair shedding, and if that were to happen, that's actually a really good sign. That means you're gonna respond to this product really well. How do patients get the consultation? Just go to happier.com and start a consultation, and then basically it's gonna ask you several questions through the questionnaire. If you want to customize the formula, there's a customization question as well, and then it will then ask you to upload your photos as well as your ID, and then you're done. Literally, the whole process takes about 5 minutes, and then after it gets sent to a board-certified dermatologist who will review your questions as well as look at your photos. And if you're a good candidate, then the dermatologist will approve your formula and write the prescription and send it to the pharmacy. Why do you need to upload photos? Because technically, this is still, this is basically is a prescription. So you have to see a doctor. So whether you're either in the office physically or online, the rules still apply, the same rules. So the doctor still has to physically see you to see how you look like. Otherwise, we don't know, first of all, what type of prescription to write. And number two, sometimes patients are not a candidate. So we literally visually have to see you to make sure that, one, you are a candidate for the Happy Head product. And two, it really still allows us to customize the ingredients for you. Great question. Thank you so much. And then also people ask, why do I need to submit my ID? Is because legally, from a medical legal standpoint, we have to verify basically who you are. So we need your ID, and we need to basically match it with your face and photos and name. So again, although basically our website it's easy to use and it's just answering a bunch of questions, we still have to abide by all the medical legal requirements as if we were to see you in the office. So we're still held to the same standard as seeing patient in the medical office, and we'd love to do that because we have a great product and we'd love to share that product with everyone, but we still have to abide by the legal standards. Can I pick it up in person? Well, my personal office, is in LA, so sometimes if you're around, yes, we do carry the product, but ideally it's best if, we ship you the product. We do use, FedEx second day delivery. So, it will be shipped basically to you right away. On our Instagram, someone asked, can I use this for if I have curly hair? It doesn't matter. So if you have ethnic hair or no ethnic hair, honestly, it really doesn't matter. I mean, this really should work for all patients. We sometimes do get photos from our patients where they are completely bald and basically they have no hair at all. In that instance, basically, it is not going to work, unfortunately. I mean, if you have no hair, Happy Head is not going to help you. But this is why we need to see your photo. Please submit it in with your consultation. If we see you are not a candidate, we'll cancel basically the order and refund you all your money. So never worry about that. Let's talk a little bit about some of the topic we talked about last week. Remember, we talked about the Derma Roller last week. We had a lot of questions afterwards as well. The Derma Roller is really important basically to, one, stimulate more blood flow to your scalp, which is important. And number two, when you Derma Roll, it kind of creates tiny holes and punctures on your scalp. So when you apply the product on top, basically it allows the product to penetrate deeper into the scalp, and it typically gives patients the best results. The Derma Roller that we recommend is the 0.25 millimeter depth Derma Roller. You don't want it to be too deep, and our recommendation is that you could put the Happy Head product on and then gently Derma Roll. Please do not be very aggressive. You do not want to make it bleed. You don't want to become very red from the Derma Roller. I know on the internet it says that patients should use the much deeper depth, which is the 1.5. We at Happy Head recommend the 0.25 millimeter depth, and you could do that every night. You could just buy it on Amazon. Basically, it's easy to get. Again, if there's any questions, please let us know. Again, do not be very aggressive with the Derma Roller. The prior week, basically, another topic we had was our topical dutasteride. Dutasteride is great. So dutasteride compared to finasteride inhibits only one enzyme, whereas dutasteride inhibits two enzymes. So in clinical studies of oral finasteride versus oral dutasteride, the dutasteride did clinically better than finasteride. One of the patient asked, how much does it cost? Will I be charged before the consultation? Yes, so typically the way it works is that you answer the questions and submit the formulas, and then you pay for it then. And then all your information gets transferred to our board certified dermatologist who will then review your consultation. If you are not a candidate, we cancel it and refund all your money. If you're a candidate, then what happens is that the process, your order gets processed, and then it gets shipped to our pharmacy, where then your product gets made and then shipped out. Thank you for that question. Again, so I was saying, so the dutasteride is a great product just because in some patients it's been shown to be more efficacious. And also the dutasteride is still fortified with other ingredients such as minoxidil as well as retinoic acid. It is still in the aloe base, so basically for your comfort. Another question from Instagram: can I start using Happy Head if I have had hair transplant about 3 months, or should I wait or should I wait after transplant? Oh, so this patient is going to have a transplant in 3 months, or should we wait after her transplant? So if we're gonna have it in 3 months, I would probably wait after her transplant. You could probably start using it 6 months after your hair transplant. The reason why it's important for you to still do happy head after your transplant is because you're still going to continue to lose more hair. The transplant hair won't, you will probably not going to lose that, but unfortunately people still, it will continue to thin out. So it's still important to use an anti-DHT medication to preserve the rest of your hair. Thank you so much for that question. Um, Again, we also get the question about the ethnic hair all the time. Will this work? Does it work as good in someone who's Caucasian compared to someone who's African American? Yes, typically it does. And in fact, I'll tell you, a lot of my African American patients basically have short hair, and I truly believe in those patients it actually works even better because it just penetrates better. It doesn't get stuck on the rest of the hair. It mainly gets to the scalp. I think those patients do really well. How long should I use the finasteride minoxidil solution? Should I consider any temporary pause during my treatment? I've been using it for 4.5 months. So you don't necessarily need to stop it. You could basically just continue doing it. Typically patients will start to see the improvement about 4 to 6 months after using the product. So I recommend continue to use it. Don't necessarily stop. If the area on the scalp becomes irritated or flaky, then you could probably take a couple of days off or a week off, but you don't necessarily need to do that. Is discoloration on the scalp common? No, it is not common. It may sometimes happen in darker skin individuals, and that could be sometimes from the minoxidil causes some irritation on the scalp. But it is not very common. But if it does happen, please feel free to contact the help desk, help@happyhair.com, and we'll be more than happy to ask our doctors about it. Either send it to me or your own doctor. Can you take breaks while using the treatment? And if so, for how long? So that's a good question. Yes, you could take breaks. Some patients take break every 3 to 4 months for about a week to kind of let the scalp relax a little bit so it doesn't get used to it. So for about a week is fine. That's no problem. And it won't really hurt your progress at all. Does the retinoic acid remove skin cells and thereby allow the finasteride to penetrate the scalp and into the bloodstream? So the way the retinoic acid works is that yes, it basically exfoliates the skin, and by doing so, it's been shown to allow the product to penetrate a little bit deeper. In the original study, it was shown that when you combine minoxidil with retinoic acid, the minoxidil penetrates deeper, and you just get basically better results. That's exactly what's going on. It just allows for better penetration, and it's a mild retinoic acid. But sometimes retinoic acid could also be a little bit irritating. Some patients could be a little bit sensitive to it. So my recommendation is that if you feel you become a little too sensitive, reach out to help desk. We are here to customize the product just for you, and we will be more than happy to take it out for you if it bothers you. If it doesn't, just let it be in there. That was a very good question. Thank you so much. Again, if you have not started Happy yet, you could use my coupon code Dr. Ben AMA50 for the 50% off your first order. Again, we are here to help. If you also need to get on a one-on-one call, we also allow, we have Dr. Ben's office hours. Typically happens on Tuesday mornings before this call. I'll be more than happy to get on a call with you for about 10 minutes and answer your specific questions. But sometimes using this form is much better because other people, also get to hear your questions. Can I use Happy Ed with RU55841? I'm glad we didn't call Happy Head like a really random number like 567-281. Yes, you could. I mean, you could use it. I don't see any contraindication with it. Again, we still don't know if the RU55841 really works or not. I really cannot really talk much about it. Again, I'd just like to go back to our first presentation of the day. How does the ordering process works? Again, it's a very simple ordering process. It literally takes 5 minutes. We've really worked very hard in order to streamline the whole ordering process. So instead of you guys driving to your doctor's office, waiting in the waiting room for 30 minutes, then basically being rushed in and out, just get online at your own convenience, whenever you want. Basically, just answer a bunch of questions, basically upload your photos, and you're done. And we will do the rest. If you have any customization or recommendations, there is a customization box, and basically say, doc, like I don't want minoxidil or I don't want the retinoic acid, and we will be more than happy to customize this product just for you, and we ship it out. Can happy head be used after to fill any areas after having a hair transplant? How long should I wait? So typically, I would wait about 6 weeks after hair transplant. And yes, it could definitely help quite a bit. Basically, just start thickening some of those areas where you cannot have transplant, because you have to realize not everyone, first of all, is a qualifies for transplant, and number two, you can't do transplant everywhere. You have limited donor areas, so sometimes patients may do transplants here, but the rest of the scalp you can't do transplant. So in those areas, I would use Happy End to not only maintain your hair, but also increase the density and strengthen your hair. Thank you so much for that question. I see today we're getting a lot of hair transplant questions, so we'll talk about that a little bit. In our office, we do hair transplants as well, along with PRP and stem cells. So hair transplant is great, but you have to realize not everyone is a candidate for transplant, because if you still have a lot of hair and when you do transplant, it could actually cause what's called shock loss, so it could lose a little more hair initially. So when we see patients in the office and they're not a candidate, we actually, we do three things. Get on Happy Head, try to use it once or twice a day, and see if you could thicken those weakened hairs. Number two, I recommend a Derma Roller. So what you should do, you put Happy Head on and gently roll. Remember, just do it for 2 or 3 minutes. Do not be very aggressive. Number three, nutrition. Nutrition is very important for your hair. So taking a multivitamin on a daily basis is very important. Adding vitamin D is very important for both guys and females. Vitamin D, 2,000 IUs a day. If you're female, we recommend adding iron to your diet, and also collagen. We are big fans of collagen, and collagen is very helpful for patients, especially with hair loss. So I like patients to add more collagen. Honestly, I don't care what type of collagen it is. We recommend the Vital Proteins collagen from Whole Foods. The Vital Protein collagen from Whole Food, but you could also buy, there's collagen textures on Amazon that you could get. There's some biotin with collagen that you could get on Amazon as well. There are tablets, there are liquids, whatever you could get your hands on, basically do it. Also, another question people always ask is that biotin is great. But I usually, another patient last week was saying that, I don't necessarily get on there and talk about biotin a lot. Yeah, because most people either have enough biotin basic in their diet, so you don't necessarily need to do extra supplements of biotin. That being said, we do have biotin in our shampoo, and we have a great shampoo and has argan oil in it, keratin, collagen. And we feel basically applying a topical to the scalp will help quite a bit. Another patient from Instagram, I am thinning at the front of the head and crown. Do I put the 0.5 cc on the front and a 0.5 cc on the crown? Yes. Yes, that's how you do. So you do one pump, which is equal to 0.5 cc in the front, and then a pump basically to the crown area. Now, let's say if you're only losing in the crown area, so we then recommend doing 2 pumps basically in the crown area. Sometimes patients are missing the widow's peaks and a little bit in the front, so we're recommend doing 1 pump in the left side of widow's peak, and then a pump on the right side of widow's peak, and then with your hand, rub the rest basically throughout the frontal area. Thanks so much for that question from Instagram. Somebody said thank you. Somebody said this is great. I could customize the product. I love it. Thank you for your response. Again, I'd like to go back to the Derma Roller question. Again, please be very gentle and do not be very aggressive. You do not want to make yourself bleed. So just gentle is the best. And honestly, I think it does work quite a bit. Somebody else asked, a question regarding the collagen. Don't need to take the collagen every day. Ideally, if you take it every day, have a regimen and take it every day, that would be great. Um, so if you do your collagen, your multivitamin and vitamin D all together, that is very helpful. We are coming out with our multivitamin product that we basically made ourselves. We really looked at a lot of the brands out there, and we tried to put everything that we could into that multivitamin. And it is coming out soon. Again, we've developed it ourselves, so it's currently in production. Um, we, Somebody asked, do we have our own collagen products? No, we don't. But no, that's something that you could easily, you know, uh, but just buy online over the counter at Whole Foods. It's just easy to get. So we typically try to focus on things that are not very well made out there. For example, making our own, multivitamin. I truly believe our multivitamin is great. It's a great product, and there aren't really a lot of products out there that are very similar to ours. So we try to really specialize in things that are not very easily available over the counter. Again, with respect to the ingredients in our product, we have three ingredients. We have the finasteride with the minoxidil with the retinoic acid. Please remember that you could change the minoxidil concentration from 8% to 6% to or completely take it out. We had a patient this morning that asked about finasteride and panic attacks. It is rare. I guess the patient was taking oral finasteride, and after a year and a half, he started to develop panic attacks. I mean, it's rare. I mean, it could happen, but right now we do have, I think, just watch out mainly for anxiety and depression. Those are rare as well. I've been practicing for almost 15 years doing hair, and I have seen very, very, very few patients basically with that. So those are rare. Somebody asked, I have a derma pen. How should I hold it in the affected area? So a derma pen, the way it is a little bit different than a derma roller. A derma roller goes horizontal, back and forth, left and right. A derma pen basically goes up and down vertical. I do like derma pens. Um, First of all, do not put a lot of pressure on it. Let the machine do the work. And the way you want to hold it, you want to hold it basically 90 degrees. I think there's a study that came out that showed if you hold it at a 90 degree, your pain is less. So hold it 90 degrees, do the 0.25 depth. And you can put the happy on top first and gently use the derma pen. Again, don't put a lot of pressure. Don't make yourself bleed. The pressure should be applying the same pressure that you apply your deodorant on. It's a very gentle pressure. Also, people always ask, how often should I change the tip? Well, if you have a regular derma roller, you could just easily switch it out once a month. And between every use, you could basically spray with alcohol. So after you're done, spray with alcohol, clean it, and then let it air dry. If you use the Derma Pen or the Dr. Pen products, just change out the tip once a month. You just don't want to risk getting infections. I did have one patient who came in and his scalp was extremely red, and he was saying that he was being very aggressive because he had read on Dr. Google that if you're very aggressive, you're gonna see better results. Well, the truth matter is that although that may be true, we don't want you to do that. I do not recommend using a depth greater than 0.25. Do not be very aggressive, and do not make yourself bleed. Please do not. I know on the internet everybody reads about the 1.5 millimeter depth. Do not do it. I do not recommend patients doing the 1.5 millimeter depth. How many times a week can I use the 0.25 millimeter derma roller? You could do it every night. That's the whole beauty of it. See, since it's not very deep, you could actually do it every night, and those patients really see great results. So apply the happy on top, gently roll back and forth and back and forth. Um, just do not be very aggressive. Again, guys, please do not use happy yet if your wife or girlfriend is planning to get pregnant, is pregnant or breastfeeding. The question that has been coming up quite recently is that if my wife is going to get pregnant in 3 months, can I use happy yet? No, do not use happy yet if your wife is just going to get pregnant in 3 months. Now, If you guys plan to get pregnant in 3 years, then yes, you could use Happy Head, and a couple of months before you're gonna start to try, stop Happy Head. Those patients, typically, we sometimes transfer them over to oral medication. Happy Head does offer oral finasteride, and you could just email the help desk, and we'll be more than happy to basically have your doctor prescribe the oral medication. So we want to make the transition as easy as possible between going from topical to oral. Again, Happy Head, we are known for topical, but we still carry oral medications because, again, certain instances requires you to go on oral. And my belief is that when you start with the topical Happy Head first, your body will get used to that topical finasteride in slow amounts in your body. And so when you go on the oral, it's not going to be a shock to your system. And honestly, I'll tell you, I have very few patients that started on topical Happy Head and then transfer over to oral, and that we saw side effects. For some reason, patients' body get acclimated to it, and the side effect profile is very, very low. Now, we also have patients that are on oral finasteride and they're not seeing the results. So then they come in to us and they'll add the topical Happy Head, and that works great. Or you could do vice versa. You could start with the topical Happy Head and in 3 to 4 months and add the oral. Those patients that are both oral and topical tend to see better results. As a woman, how long should you stop treatment before you get pregnant? Well, first of all, we typically do not give topical finasteride to females below age 50. We typically don't. There are some exceptions, but we don't. Number two, we typically tell females to stop 3 months before basically they want to get pregnant. So that's a very good question. Thank you so much. Again, another person on Instagram said, can I use topical finasteride if I'm a female? Well, it all depends on your age. Again, this is why the consultation is very important. The consult with our board certified dermatologist. If you're female above age 50, you could use, basically, we could give you the topical finasteride just because, most likely you're not going to become pregnant after age 50. But below age 50, we typically do not prescribe it. Another patient on Instagram asked, I am currently using topical finasteride from another company and I'm in my 30s. Well, look, at Happy Head, we truly believe that your safety is number one. And we take the high road approach, and we do not give topical finasteride to females below age 50. That's just how we do it. There's a company policy. Again, there might be some exceptions, but we typically do not. But instead, what we do, we have topical spironolactone, and we're one of the really very few companies in the US that basically has topical spironolactone for females. And we could combine that with minoxidil and retinoic acid. So we do have a lot of options for female below age 50. You just please have to get in contact with our doctor. And we also have oral spironolactone, that's an option, and oral minoxidil. So if you're female below age 50, you have 3 options: oral minoxidil, oral spironolactone, as well as topical spironolactone fortified with minoxidil. So, and again, we have, if there's any questions, reach out to help desk, or you can submit your consultations and your doctor will customize the product for you. What minoxidil concentration do you recommend women to start with? We typically start females at a 6% concentration, and we've been doing that for many years, and they've done very well. There are some females that want a higher dose because we also offer the 8% for males. So females always ask, well, why don't you give females the 8%? The reason for that is because the 8% minoxidil could cause some peach fuzz hair growth on the face. So we typically don't want to do that. But again, if you're female and you want the 8%, you would just let the help desk know, and we could accommodate you for that. That's not a problem. Just know that you could get some peach fuzz hair growth. Again, some females don't mind, but I just have to tell you that's one of the side effects. Thank you so much for that question, by the way. Okay, guys. Well, the time has come. Again, thanks so much for all the questions. Please join us every Tuesday morning for another AMA with me, Dr. Behnam. I'd like to thank Eric, our VP of Operations, as well as Evelyn, who sets everything up for us and types everything up like crazy. One more question before we go. If you have side effects, such as nausea from topical finasteride, can you use it once a day or will it go away? So the nausea is extremely rare side effect from the topical finasteride. But yes, if you're having side effects, please use it once a day. Um, yeah, please. Again, the soft usually is when you have it when you take something orally, not when you apply it topically. But if you're very sensitive, I guess it could happen. Yes, go down to once a day and see how it happens. And once you start using them once a day, and if you do not have any side effects after a couple of weeks, maybe try to do it twice a day and see if your body gets used to it. All right, guys. So we're going to see you guys next Tuesday morning. If you have any questions, please feel free to reach out to us on our Instagram, or basically you can also reach out to our help desk at help@happyed. Again, if you have not tried it, we encourage everyone to try it. It's an easy process to fill out the consultations and submit the photos. Use Dr. Ben AMA50 for 50% off your first order. Again, remember, this is a customized product just for you. This is made just for you. We literally make Happy Head fresh every month. It's all about you. We don't make a product that is a one size fit all. We customize the product. If there's any issues with it, we'll be more than happy to fix it, to fix the issue, change the formula, and ship you out another one, because we want you guys to be happy and we want you guys to be a long term customer of us. Okay, well, thank you so much. Have a beautiful day, and we'll see you guys next week.